Okay, I think we're live. Welcome to everybody from wherever you're linking in from. Yesterday, just for those who are interested, we had about 770 people linking in to listen to Neil and his wonderful way of sharing his experience and knowledge and so on. So strong interest, and there was a high percentage of persons linking in from Africa in addition to Asia. So it's wonderful to see the level of interest from all parts of the planet, including especially Africa as well, which is wonderful to see that level of interest. So we're going to have another full, roughly 2.5 hour session this afternoon. I'm going to stand back as moderator, and I've asked our APMEN Vector Control Working Group coordinator, Mrs. Wulandari. She has a master's degree in medical entomology, so she's appropriately qualified and understands these issues and deeply experienced in them as well. Wulan will moderate the afternoon's event for us. So again, thank you all. Thank you also to Neil. I'm going to hand over to you now, Wulan.
Yeah, thanks so much, Dr. Leo, for the opening. So, yeah, a very good day to all the audience who are listening in. It's a pleasure to have you as part of this day to online training on designing entomological data system for malaria control. So please know that the sessions are all being recorded and will be available on the orin.apmen.org website. And if you want, just in case you want to go back to the lessons or share with friends, and we'll put the link on the chat box later. So this online training run for about 2.5 hours per day. So we completed day one of training yesterday and today. So the training consists of a 40 minutes presentation followed by 20 minutes comfort break in midway, and then we will have post-test afterward, and then followed by a short Q&A session at the end. Please note that the certificates of attendance will be issued to all people who attend each of the 2 days for at least 90 minutes each day based on Zoom system records of attendance. Please note that the certificate will be sent to the email address you provided during Zoom registration. So during the training sessions each day, feel free to post questions and put them in the Q&A box, not the chat box, because we are unable to monitor questions on the chat box. And then I will hand over to Neil for the presentation. Thank you.
Hey everyone, good morning, good afternoon, good evening, wherever you are, and welcome back to day 2. So I'll start off with my slides as usual. I have to share my slides and take a second every time while I'm sharing them. So there we go. And day 2. I hope y'all can see my slides.
If you can swap display, please, Leo.
Oh, which display? Am I in the wrong display?
That one.
Display.
On
Here.
the top. Yes.
Perfect. Who? Which one am I doing wrong?
So on the top there, you will see.
Wait, which one?
You can go back to the previous version. You will see that menu on swap display.
Here.
So yes, click there.
Yeah. And
then on the top there, swap display.
Perfect. Oh, I know why this happened because I have another screen over here. That's what happened. Okay. Thank you for that, Wulan, and for the help and for your patience, everyone. So we are on day 2 today, and we will have better internet today because I'm at ICDDRB in Bangladesh, which is why I have a bigger screen here as well, but I'm on my computer. So today we're going to start off with, as yesterday, Leo suggested I introduce quickly the entomological surveillance planning tool. And this is a decision support tool, and it helps you and leads you through entomological surveillance activities, as well as how to interpret your data and guide your programmatic vector control decisions. There's a lot of information on here, and please note we're sharing these slides. The ESPT is part of the overall training we're doing today. So if you imagine the entire training we do today, a couple of the modules is what the ESPT is about. There's a PDF file, and you can download it if you wanted it. And that's if you just Google MEI and ESPT, you can get that file. There's also YouTube videos available online. So if you like watching videos on YouTube, happy to go look through them, and it'll tell you how to move through the ESPT and how to use it, and just the logical structure of how to think through entomological surveillance. All the videos are narrated by my colleague Mercy. By the way, there's a little ESPT, a small ESPT, which stands for electronic ESPT, and you can download this for your computer. Unfortunately, we have both Mac and um, other versions as well. And this is also available on the same website as you download the PDF. And what's really cool is even though it leads you through everything in a modular electronic format on your computer, you can download your output. So you can actually have a Word file that you can cut and paste and copy things into it. For example, for a report, or you want, of your boss says, hey, I want you to design an entomological surveillance plan for this question. And you can actually go through the whole ESPT and have 5 or 6 different plans, and you can say, well, which one fits the budget? These are all my reasons for it. I want this for that reason. This is what works for that. And so you can have every explanation in there for whoever you need to report to. So you can download that file from this little ESPT that you can download on your computer. And if you have any questions on the ESPT, these are the people that you can contact, Mercy, Elodie, Eddie, or me. And these are emails. You'll have these slide sets, so you don't have to copy them. In order, it's Mercy, Elodie, Eddie, and I think you can see me. Okay, so continuing with the training. So yesterday we went through why entomological data systems matter, what kinds of data we need. And once we understand the data we need based on the questions and decisions, we move to how to design our surveillance systems. So today we're going to talk about data quality and management, how to interpret the data, and also how to get from looking at that data and information and how to move to action, how to use that in making decisions. Uh, so data quality and management. So now we've collected our data. So how can we ensure that surveillance data can actually support decisions? So I'm going to start off with why good surveillance systems fail, right? So on the right, we collect our data, we put into a database, we analyze our data, and then we hopefully will use that data to make decisions. However, these systems fail at every point, right? Usually for multiple reasons, and this can be because there's data missing. There can be inconsistent data entry, poor standardization, delayed reporting. There's lack of data ownership where no one wants to actually look after the data. And of course, there's no pathway to actually making a decision, right? And I'll go over most of these. Uh, and a lot of programs focus so much on data collection, uh, and so much effort and money and funds and capacity spent on data collection. And when data is entered incorrectly, or we don't end up cleaning the data to get a good data set that can be analyzed, right? And that results perhaps in reports being delayed. Or if no one uses these results, right? The entire surveillance system will fail. So at every step of this system, we can have things that can happen that will result in failure. So this is the surveillance data life cycle. It's pretty intuitive, right? First of all, what is your decision you have to make? And therefore you ask a question. Then you pick the indicators that will answer your question. Then you go out and collect the data. Once you collect the data, you have to store it. And once it's in storage on your computer, on an Excel file or anything, then you have to clean it. You have to make sure you take out all the mistakes and make sure your data is good enough for analysis, which is your next step. Once you finish analysis, you interpret your data. How does it impact your decision? Did it answer your question? And based on that, you do something about it. And hopefully that results in better malaria control, right? So that is your data system, your data life cycle, the everything that happens with your data. And at every step, something can go wrong. Uh, and many of us focus on the collection of the data, right? We're going out collecting all this data and we focus on that. And once it hits our computers, sometimes we forget about it and don't take the necessary steps to action. So what makes good data? The sort of 5 steps that make good data. One is it accurate? Is it correct? Does the data represent what question we're trying to ask? Is it complete? Like what data is missing? And many times, this is actually quite true. In many, for example, if you just have an Excel sheet, there'll be missing cells with empty things, and we don't know what that means. It could mean the data was not collected. It means the data was not entered and it's actually there. It could mean that it's zero. Could mean a zero. We don't know what it means. And if there's a whole bunch of cells that are empty, right, the data could change, your analysis could change. So is it complete? Every cell, every single data point has to be entered. So we understand if the data is missing, if it's there, right? It has to be recorded in the same way. So that's consistency. Is data available when it's needed? So it has to be collected and processed and analyzed in time. And can the results be reproduced, right? Did you produce reliable data, right? So you can have tons and tons of data, but it could still be of really low quality. And I've seen lots of data sets like this. And the key question is at the bottom is can the decision makers trust this information, right? Can we trust that the data we're getting is actually good? And that is reliant on you. So common problems with data are things like missing values. And I mentioned that earlier, like a 0 versus a 1 or a blank cell. Or maybe a species were not recorded. And I'll actually get into this a bit. Sometimes there are records that are duplicated, and that can mess with the data. Incorrect dates are quite common, and especially when you factor in things like date systems, like in the US, we use the month and then the day and then the year. Versus in a lot of countries in Asia, we use the day and then the month and the year. And you can imagine the confusion that can cause when you don't actually record how you recorded the date, right? And inconsistent names. This is a common thing I see, especially with species names, and we're looking at entomological data. So you can record Anopheles gambi, or any Anopheles, Culicifaces. And over here, I just listed out 1, 2, 3, 4 ways we can record gambi. And to me, looking at it, yep, it's all the same. But to a computer, they're 4 completely separate things, right? So we need to be consistent, standardize how we look at our data. Another common thing is missing site locations or GPS locations. And I've encountered all of this and more in all the data sets. In fact, just yesterday, I had a big database issue and I had to go through a whole bunch of things. And I was like, oh no, if I had hair, I would pull it out because I was frustrated. And many national systems fail because of the quality of data, not in the surveillance design, not in their entire data system and how they collected the data. It's the quality of data that results in bad outputs. So I want you to quickly look at this data set and try and find the mistakes. Unfortunately, you can't tell me what they are because of the format we're in. But here's just an Excel sort of sheet looking at mosquito data. For example, here's a collection R, the start time, temperature, humidity, rain, wind speed. JND collected the data here in this cell. This is the code, and so on, right? If you look through this, if anyone found a mistake, could you put a plus sign or a thumbs up or something so I know? Only one person found a mistake. Oh, only one thumb I see up on my screen. Oh, I see a bunch of thumbs. Oh, that's good. Okay, so I'm going to outline the mistakes and I hope you found them all. There are, I think, four mistakes. So there's a mistake in the time entry, right? So it says 22 to 23 and the time entered is 23:02. That's wrong, right? That should be for the next hour. Or maybe they entered it wrong. Uh, did it rain? Yes or no? It can't yes and no, right? It's one of them. Here's an empty data cell. We don't know what that means. Did they forget to enter the data? Uh, or did they not collect the data? And then, of course, the temperature here was 300 degrees. So I'm pretty sure we were not on the surface of the sun. Oh, wait, no, that's cool for the surface of the sun. It's too hot there. So here are just four examples of data sets. Maybe this is raw data. And the next objective is to clean this data to have something that can be analyzed. So the next thing is data dictionaries. I really hope you'll know what these are and use them. And in my lab, a data dictionary is non-negotiable. As in, if you don't have one, I'm sending you I'm sending you the data back. This happened 2 days ago when people from my lab sent me a data set without a data dictionary, and I sent it back. I'm not even going to look at it if it doesn't have a data dictionary. A data dictionary allows anyone and everyone to understand exactly what's in your database. And I'm just using Excel databases here to make it simple. This ensures that everything is recorded in the same way and everything is standardized. It is really important at the beginning of your study, right at the beginning of anything you do, beginning of your data system, making a data system for your country, for your Ministry of Health, for your study, to establish a data dictionary that describes exactly what you're going to be putting in it. So every column header will tell you what it is and in what unit to record it or the allowed values. For example, if the column header is species, the definition would be Anopheles species name, and let's say it's morphological or molecular. Those can be two columns. And the allowed values can be Anopheles gambiae, Anopheles arabiensis, Anopheles finensis, anything. I just made up three over there. And you can have the full word or just ANG or ANA, but you'd want to explain what ANG and ANA mean as well, right? And for example, if this is a database, this is just a screenshot. And if I sent you this data, would you know what ND code or SR no or code no or what any of these mean? The probably not, right? You have no idea. So one thing that bugs me is that if someone sends me the data, oh, sorry, if I send someone data and there's no data dictionary, they're going to be calling me, WhatsApping me, and emailing me. What does ND code mean? What does code number mean? What does ITS2 config mean? What is 595 in the ITS2 config right here? What does that mean? So they're going to be asking me all these questions, and I have work. I don't want people to bother me after I send them good data. So what I do is make a data dictionary. So absolutely everyone I send the database to will know exactly what's in it. And it's really simple. All I do is create an extra sheet, and at the top of it, I put the contact person. Unfortunately for you over here, it's me. And then the study name. And then here below that is the main part of the data dictionary. And it's basically you take the column header and you type it out there, you put what the explanation is, right? And then the variables, and that's it. It's as simple as that. So you can see the collection method is the collection method, and the LT means light trap, PSC means pyrethrum spray sheet collection, HL, this should be HLC. HLO, HLC means, oh no, actually it means human landing catch outdoors. So HLO means human landing outdoors. So you can see this way, if I send this database to anyone, they can just reference the data dictionary sheet and understand anything. And they'll know exactly how and when to analyze anything because they know it. Another important part of data dictionaries is sometimes we're working across countries with different languages. So I'll duplicate the entire dictionary in the other language as well. So this is a data dictionary between the US, which is in English, and Senegal, which is French speaking. So I have a French data dictionary and an English data dictionary. And a person who understands French can easily, who only speaks French, can easily analyze the data based on that. So this is something that is non-negotiable in my lab, and that's what I do. All of us do. And this enables standardization, right? It standardizes what we name things. If you see here, we know exactly how to name things. It standardizes all the variables and it standardizes everything in our database. And it's really important. An example here is a name, the Anopheles species name. We have Anopheles gambi with two spaces in between, Anopheles gambi in italics, Anopheles gambia spelled slightly different, AN gambi, AG. And all of these can mean the same Anopheles gambi, but computers look at this as being completely different. Absolutely different. So part of the cleanup process, a lot of the time I'll find little mistakes like Anopheles gambi and an Anopheles gambi with a space in it, and I'll have to go through and clean these up and standardize everything so it can be analyzed properly. And for the database, we want to pick one. We don't want to pick all these because it's just messy then. Metadata, right? So metadata, which we went over in the first day yesterday, tells us information about the data. And for example, on the data sheet over here, you can see collection hour, start time, temperature, humidity, rainfall, wind speed. All this is metadata that helps us understand the data better. On the left, I've listed out, date, time, weather conditions, and so on. So all this can help us understand the data better. Without metadata, results are difficult to interpret. For example, if the report says 250 mosquitoes were sampled, what does this mean? Right? That's a data point, 250 mosquitoes, but what does it mean, right? I have no idea. Like, I would like to know where, when, how, and why the data was collected. Where in terms of like the location, which city or village, was it inside? Was it outside? Was it in the forest? Right? When? Were they daytime collections, nighttime collections from 12 to 1 in the morning? Was it from 6 to 7 in the morning? Was it in the rainy season? Where there's this 250 mosquitoes represent a week of collections, a single day of collections, a single hour of collections? Did I use HLCs or CDC light traps? Right? I have no idea what 250 means. And I'd start off with asking, what was the question? Why was this data collected? Where was it collected? When was it collected? And how it was collected? Without this, like data without context can be completely misleading. And this brings us to another important point. A lot of times with entomology, we try and collect the most mosquitoes, right? Let's use this trap, it collects the most mosquitoes. Or let's go to that site, we could collect the most mosquitoes. And the most mosquitoes doesn't necessarily answer our question. We want representative numbers of mosquitoes, which might be zero, right, based on our question, and not the most mosquitoes. So 250 mosquitoes were sampled, or zero mosquitoes were sampled, means very little until we know why we're collecting, how we're collecting, when and where. The next point is unique identifiers, and I'm sure you'll all know about codes, and every record, every specimen, every data point needs a unique ID. And here's an example of data from Mozambique, Nampula, and this is mosquito sample, the site number 1, and this is the mosquito ID. And you can see just from the mosquito ID, it's from Mozambique in Nampula at site number 1, and this is the date, I assume the date of collection, and mosquito number 10. But of course, we need a data dictionary to understand that, right? Please remember, you read this and you have no idea what it means. So I would have to make a data dictionary to explain what these codes mean. I know them, but if I sent you this database, you'd be like, Neil, you're stupid. Why are you sending me this? Please explain this to me. Right. So unique IDs with their explanations prevent confusion. It enables people to understand the data better. It's really important to have unique IDs when you're looking at longitudinal surveillance over time. So you can go back to collections. You can understand exactly which specimen was from which collection. And when you're linking multiple data sets, this is really important. And that's on the next slide. So data sets talk to each other, right? Your mosquito specimen need to be related to which site you collected them from. Your mosquito ID, for example, the ID on your mosquito specimen will be connected to the number of mosquitoes, which hour of collection it was. Was it inside? Was it outside? Was it resting on a wall? Those data columns need to connect to that mosquito ID, to what species it was, right? So you can see different data sets, your site ID data set, your mosquito ID data set, your human behavior data set, your species mosquito data set, all talk to each other. And these linking uh, points are especially important. So, for example, over here, the site ID and the mosquito ID connect everything together. So, making sure in your database that these are cleaned up well and making sure that these are outlined really well in your data dictionaries, as in these are linking data points, right? These are common identifiers, and this enables us to allow databases to talk to each other and understand, pull everything together for analysis. So digital tools is just one slide on this, and there are multiple. You could speak for hours on this. However, software changes. It changes all the time. So we can speak for hours on this, and tomorrow someone will use something different. That I've just listed four out here: Excel, Kobo, ODK, and DHIS2. There are advantages and disadvantages to each. Different people use different ones. The key point here is to utilize them to manage your data well, right? Software changes, but good data management principles do not. So make sure whatever you use good data management principles. You could also store your data locally on your computer or in the cloud. And there are several issues, positives, and negatives with both. With local storage, you can work offline, and there's greater control with the data, as in like sharing and everything. And with the cloud, it's accessible to multiple people across the planet. You can back it up, and it's really good when you're collaborating. There's no single answer with what's better, cloud versus local storage, and it depends on your requirements. But a really important thing is to consider national regulations and rules as well as institutional IRBs, because sometimes we will have a lot of personal data on it. People identifiers, data points that identify people, their houses, their illnesses, right? You really don't want anyone and everyone to access this data. I'm sure if you were in these data files, you would not want anyone, unknown people, to be looking at where you live, how old you are. Especially if you're a woman, I assume. You don't want people to know all the stuff about you, and it's available out there. So you would probably want to make sure you comply with your IRB approvals, your IRB rules, and your national regulations. As an example, in India, we cannot put anything on the cloud because in India, India doesn't allow data from India to be shared across borders unless there's very special permission. So cloud-based storage is really difficult unless it's completely within India. Who owns the data? Now, this is really important, right? You have to think and talk about this with all your partners all the way at the beginning. Understand who owns the data. Sometimes the funder believes they own the data, sometimes they do. Sometimes the country believes the data is theirs, and sometimes it is. Sometimes it's not, right? Access rights. Who has access to the data? Can I share it with anyone? Can I share it with my colleague in the office down the corridor? Maybe, maybe not, right? All this depends on ethical approvals and actually who the data belongs to and who has access rights. And we all need to figure this out at the start of the study, because there's nothing worse than midway through the study, someone wanting data and you sharing it and finding out you're in a lot of trouble. Or midway through the study, someone wants the data and they realize they can't really get it and they get really upset at you. So understanding who owns the data, who has access rights, and who you're allowed to share it with is really important. National policies, of course, come in. For example, India doesn't allow data to be shared outside India unless there's very specific permissions. right? And as surveillance systems grow and as this becomes increasingly difficult and important to understand how to go about this. So putting things in place so that you understand everything protects yourself, right? So here's an example of a bad data set. And let's say a district collected mosquito surveillance data for about 3 years, and there's no data dictionary. There are multiple site names for the same site. There are missing GPS coordinates and different species naming systems, like I gave examples before. Do you think this data set can support intervention decisions? I'd like to see thumbs ups or thumbs down. They show up on my computer, but I don't see any thumbs. But that's okay. So, what would you fix first? Would you fix standardization as a try and get the data all standardized? Would you try and develop a dictionary? Would you try and get all the site IDs corrected? Or would you try and get all the metadata associated with it? So think about this. What would you do first? This data is kind of a mess. What would you do first? So actually, there are two people in front of me who is participants, and I'm going to ask him, what would you do first? Okay. He said he would do the standardization. Yeah, okay, that's a good answer. I would also start, so when you're standardizing, before you standardize, you have to make a data dictionary. Correct? Yeah, he agrees. So to standardize, you have to list out everything, what goes in there, and define it, and put all the variables. So he's right. Standardization is super important, and to be able to do standardization, you have to make the data dictionary. So that's the first step I would do. And the reason for doing the data dictionary is for standardization. So he is completely correct in that respect. So thank you. So sustainability. One principle is a very useful principle is that if you develop a good surveillance system, it's only good if it's if it's still there 5 years from now or 10 years from now, right? A lot of times, especially when countries are externally funded, they build really good systems that are really complicated and nice, but when donor funding ends, these completely collapse. So, how can you start or how can you build a system that is sustainable, that is simple, that is structurally intact and can continue pretty easily so that you don't have any breakdown when funding goes down? So, that is where the simpler systems actually work better. And so, just with this first set of slides, key takeaways is that good decisions require good data. Data quality matters more than data quantity, far more. Data quality matters far more. As we just discussed, data dictionaries are essential. In my lab, if I would repeat, if you don't have them, I'm sending the data back. And if you do it more than once, I'm not going to be happy. Metadata is super important and provides context. Unique IDs enable integration and simplicity, like being simple about this, straightforward, beats complexity. So that is my quick presentation. And if you give me a second, I will have a sip of water and start up the second one.
Sure, Neil.
Yes. Are we good, Wulan?
Yes, we're good. We have around 16 minutes for until we have the 10-minute coffee break.
Thank you. Yeah. So now the next part is data interpretation and integration. I'm going to have a sip of water, so give me a second. So now we have our surveillance data. We've cleaned it up. Um, Maybe we've analyzed part of it. And how do we turn this data into information? Well, that's where you analyze it, right? So we've discussed why data systems matter, what we need to put in. I'm repeating myself now. How to collect and data and manage our into systems. And now, how do we convert this data into this information that supports data control decisions? So data is not information. Like there's a difference. And I think even me, have commonly like confused it in my head. So data are observations. For example, 250 mosquitoes, that's an observation. Information is meaning, right? So 250 mosquitoes were biting me outside in 1 hour. Whoa, that's a lot of mosquitoes. But that's information. That tells me the mosquito biting is really bad in that hour I was sitting outside. So 250 is the mosquito count. Information will tell us more about it. Information supports decisions, right? So if someone says, I caught 250 mosquitoes. Again, what does that actually mean, right? There are multiple questions I would ask, like what species were they? Where did you catch them? When were they caught? What are you comparing this to, right? Is this high or low compared to everything else? Was it in a week or in a day or in an hour? So all this data points, all the questions I just asked would convert that data, those 250 mosquitoes, into information with which we can make decisions. So the interpretation of the analysis pathway, and just as an example, data would be, for example, the indoor and outdoor biting rates. Information would be the outdoor exposure risk. Let's say there is much more biting outdoors than indoors, and we can get that from the indoor and outdoor biting rates. And the decision we would make is we need to protect outdoor spaces as indoor protections are insufficient. This is just an example. And the action would be to supplement that site with outdoor interventions. So over here, we can see we take the data and we convert it into information by analysis, and then it's all directed at a decision and actions. I hope that made sense. Yeah. Here is a couple of examples on interpreting vector density. Let's say someone says, in village A, we had 50 mosquitoes, and in village B, we caught 200 mosquitoes. What does that mean? Nothing, right? It means almost nothing. So, does this mean, for example, does village A have 4 times more malaria than village B because we caught 4 times as many mosquitoes in village B? Nope, it doesn't mean that. It doesn't mean anything, right? So again, the questions I would ask is, first of all, are these vectors, right? What kind of species were they? What is the standardized measure of collection? A number of mosquitoes per day, per hour, per night, right? Is this the total number of mosquitoes, or is this the biting rate, right? Is this biting behavior? What is the biting behavior? Were these collected indoors or outdoors in the forest? Human behavior. How does this relate to humans? Were humans at that site when the mosquitoes were being collected? If there were no humans there, those mosquito biting rates really don't matter. And also, was this even a biting rate? I just realized. I just said 50 mosquitoes. We don't know if it was a biting rate. Does epidemiological data match? Right? When was the data collected in which season? So you can see, how do we interpret vector density? Vector density doesn't mean much without all this other metadata associated with it, right? Density alone rarely tells the full story. So how do we interpret vector density? Vector density is useful when we know more about it, for one, how, when, where, why it was collected, but it's useful for looking at trends, as in seasonality. When do vector densities go up? And are those upward trends in vector density associated with malaria transmission or dengue transmission? Vector density can tell us about the impact of interventions. So we put bed nets out, and Anopheles gambiae and Indo-biting species, their densities go down. So vector density can tell us about that, the impact of interventions. Vector densities can let us compare sites, right? With bed nets, without bed nets, sites close to larval habitats, sites far from larval habitats, sites with window screens, sites without window screens. So we can do multiple things like with vector density. It's not useful to explain everything. We don't understand everything from vector density. We cannot understand exposure from just vector density. Vector density tells us the number of mosquitoes. It does not tell us the number of mosquitoes that are biting humans at that site, right? Vector density by itself doesn't tell us what interventions to use. Species composition. So why species composition matters? So let's say we have two sites here. And in one site, we have 20% arabiensis and 80% Anopheles fenestus. Now, Anopheles arabiensis, for all those who don't work in Africa, Anopheles arabiensis in orange likes biting outdoors and likes biting cattle more, but it also bites humans a lot. Anopheles fenestus loves biting indoors and loves biting humans. They're a pain in the neck. They love biting humans. And let's say both these sites have the same amount of malaria, right? So we have the same amount of malaria at both these sites and different proportions of these species of mosquitoes. As you can imagine, each transmission system is actually very different. In the one on the left with more fenestus in blue, most of your transmission is happening indoors, probably 80% perhaps, with the fenestus going indoors to bite humans. In this transmission on the right, in the orange, with mosquitoes biting outdoors, Anopheles arabiensis, most of the transmission will be happening outdoors. So different interventions are probably needed in each system, right? So understanding species composition in association with density would be super important and nice to have. And this is just a very generalized, I made this generalized table. Let's say at the site, Anopheles gambi, as I said, likes to bite indoors, so indoor interventions might be effective. Sorry about that. Anopheles arabiensis likes to bite outdoors, so there's greater outdoor risk here. And Anopheles fenestus likes to bite indoors as well. However, if you note in the figures above, I don't have Anopheles gambi, and I don't have Anopheles quadriannulatus, right? So if our figures above are not complete, if we didn't sample all the vectors at that site, we still don't have a really accurate uh, depiction of species composition. And I put in Anopheles quadriannulatus since it's a non-vector, right? And let's say 80% of our mosquito catch was Anopheles quadriannulatus, we shouldn't look at mosquito density, right? Because it's 80% of those were non-vectors. We can take them out of any of our calculations, any of our assumptions about where and when people are being exposed. So understanding species composition at a site is actually quite important. The human biting rate. The human biting rate is the number of mosquito bites received per person per unit time. On the right, we see Brandy, who's a student I used to work with, who's now a very prolific researcher, and she is doing a human landing catch with mosquitoes in Indonesia. You suck up the mosquitoes that land on your leg in these tubes, and you put them in these cups, and you can do 1 cup per hour, so you understand the number of mosquitoes approaching a person to bite them every hour. This calculation, the number of mosquitoes landing on a person per hour, gets us closer to exposure. What is exposure in the community? But it's not the whole story, right? And I'm going to explain why. It's more informative than just mosquito density by itself, but it does not tell us what's happening in the community. It tells us what's happening to Brandy on the right, sitting there, but it doesn't tell us what's in the community. And the reason is because, I think it's coming up later on. I'll come to the reason why. And I'd like you to think about it before I come to the reason why it's not actually telling us about community exposure. So how do we interpret human biting rates? Let's say in village A, we have 10 bites per person per night, and in village B, we have 50 bites per person per night. What does this mean? Right? So in village B, the biting pressure is 5 times as more. But which village has more malaria? Does this tell us that? Does this tell us that? It doesn't, right? So the questions we should ask First of all, are they vectors? What species are they? Where are they biting? Are humans actually the community? Because this would be collected by human landing catchers. Where is the community when these mosquitoes are biting in that location? What does the epidemiology say? Does the epidemiology say that one village has more malaria than the other? Right? So again, there are all these questions we should be asking about the human biting rates. And let's say we want to understand which village should be prioritized for giving, let's say, bed nets or an intervention. We'd want to understand all this metadata towards turning this data points, 10 mosquitoes per person per night, into information with which we can make decisions, right? But is this the actual exposure we have in communities? I'm asking this question because I'll get to it in a couple of slides. So the EIR is the entomological inoculation rate, right? So we're moving from bites to infectious bites. So if 100 mosquitoes bite me, it does not mean that everyone is going to give me malaria. If only one of them gives me malaria, right? I get one infectious bite from 100 bites. And so the definition of EIR is the number of infectious mosquito bites received per person per unit time. And this can be per night or per month or per year. And you will be surprised, or maybe not so surprised, to know that we in some sites in EIRs can be 400 infectious mosquito bites per year, which is ridiculously high. Sure. And bed nets and other interventions have reduced them drastically. So EIR, the entomological inoculation rate, combines human biting rate, which we just went over, with the sporozoite rate. And you can Google how to calculate it. It's pretty simple. You just multiply the human biting rate by the number by the infectious the number of infectious mosquitoes by the sporozoite rate. This gets us closer to actual infection. So how do we interpret EIR? And give me a second while I take a sip of water. So let's say in village A, we have 50 bites per person and 1% of them are infected. In village B, we have 10 bites per person and 10% of them are affected, right? Isn't that approximately the same number of mosquitoes? Approximately, right? Which presents greater risk, right? So density alone can be misleading, right? Because village A has more mosquitoes, but village B has a 10% infection rate. So just because you have a lot of mosquitoes doesn't mean you have more malaria. You'd want to map your number of mosquitoes to your infectious rates to your and get your EIR. And now human behavior. So all these previous calculations are usually done by people like me or an entomologist sitting outside collecting mosquitoes in these transmission sites. Mosquitoes by themselves do not determine exposure. So all the density is based on mosquito behavior. The EIR is in the mosquito behavior bucket, but the humans have to overlap with that. The community of people that we're looking at have to overlap with the mosquito behavior, and that overlap tells us where and when people are being exposed to malaria. So exposure is different than biting rate, right? This is a really important concept. Exposure is caused by the interaction between your community and the mosquitoes. On the right in the figure, you can see where they overlap is where you have exposure. It's not mosquitoes alone. And here's the awful picture. This is a picture that some of y'all might have seen before because I use it a lot. It's my leg. I was in Papua and I was doing a human landing catch and I got chewed up by mosquitoes. I started the collections in the middle of the night and I was outdoors and they were all these mosquitoes. Like I couldn't even catch them fast enough. I was trying to catch them on one leg, they were landing on the other. There were just so many. So they're managing to bite me. And while I was catching them on my legs, if you noticed earlier, my head is a mosquito buffet. So they were all landing on my head and biting me. And I was going a bit crazy. And I was thinking, Everyone in these villages are being exposed to mosquito bites in the middle of the night. This is when all the malaria transmission is happening. And then I looked around, and in the middle of the night, there were zero people around me. Everyone was indoors under their nets. And all our data, most of our data, is collected by people like me, like you, sitting outside or sitting inside collecting mosquitoes. And we are not the community. And the key point is with those 400 or 500 mosquitoes biting me per hour outside, what was the community doing? They were all protected inside. So it doesn't matter. All those 400, all my poor leg, my poor suffering leg, uh, didn't impact anything. It didn't help me understand where and when people were being exposed in that community. So integrating human behavior into the analysis is absolutely important. And now I don't do any studies because of that bitten up leg. We always incorporate human behavior with the mosquito behavior and understand the overlap. If you attended the other APMEN training, there is a session on that, and we can easily, uh, I can easily share that with you all at the end if you all want it. Please let us know. So how do we integrate human behavior, right? And as an example here in Village A, everyone goes indoors by 8 p.m. And in Village B, people are outdoors until midnight, right? Different exposure. This results in different exposure and actual different intervention needs. And I'll explain why. Like, which has greater risk? Again, everyone indoors by 8 and everyone outdoors until midnight are data points. We don't know which is a greater risk until we understand when mosquitoes are biting and what interventions are in place. If everyone's outdoors without no interventions and mosquitoes are biting then, there's greater risk outdoors. If everyone's indoors and all the mosquitoes are biting indoors and everyone's under a net, there's still no risk indoors because everyone's under a net. So, for understanding what humans are doing, are they being protected or not protected at that site and time? And what mosquitoes are doing will enable us to understand exactly when and where people are being exposed to mosquito bites, to infectious mosquito bites, and what specific intervention will function in that place and time. I hope that made sense, right? So that's again, so how do we underestimate actual exposure? So an easy way of doing this is to look at indoor biting rates and outdoor biting rates and look to see where humans are. Are they inside or are they outdoors at that point in time? And if they're indoors, are they awake or asleep? If they're indoors, are they asleep under a bed net or are they asleep without a bed net? And that will tell us a lot about transmission. And of course, a lot about exposure, I mean. And if you're outdoors, if people sleep outdoors at your site, you'd want to look at the same data points outdoors as well. So transmission occurs when these behaviors overlap and there's no protection, right? That's where exposure happens. And as a note, Ali Omar in Zanzibar did the study in Zanzibar, in Pemba, not Zanzibar. That's a mistake, Pemba. And here is his graph. And what he did was, it's a little complicated, but I'll walk you through it. What he did was he tried to understand where and when people were being exposed. So you look at human behavior. Were they inside? Were they outside? Were they asleep or were they awake? And were they using a bed net or were they not using a bed net? And it's a simple calculation that I can send everyone. And what he found was, I'll just go through two examples. Let's say two examples. On the bottom left, number D, age under fives, we can see that about 38% of kids under fives over the night were under a bed net. So this represents that they were protected, right? And 33% were outdoors awake without bed nets. So this represents where they might be being bitten. So this is exposure profiles. 18% were indoors awake without bed nets. Now we can't protect them. And 11% were indoors asleep without bed nets. So now you can see just from this is where under fives were being exposed and in Pemba. And just from this, you can see if we, in the light blue over here, right? If we increase bed net use, we could increase protections by at least 11% to about 50%. And when they're outdoors, I'm not sure what we could do. And when they were indoors awake in the blue, perhaps we could give them spatial laminators, right? Or something that'll protect them then. But if we look at females above 15, sorry, this is people above 15, this is completely different over here. If you compare D to F, you can see all of a sudden the kids above 15 people above 15, not kids, people above 15 were outdoors in yellow a lot more than the kids. They were also using bed nets in the crosshatch bed net like pattern a lot less. So you can see just based on human behavior, and this would be the same mosquitoes in the same houses. Human behavior changes where and when people are exposed to malaria. And Ali Omar actually did this really good job of looking at males overall, females overall, uh, people under the age of 5, from 5 to 15, and above 15. And you can easily see where and when people are being exposed. He did a really good job. And he is in the Ministry of Health, and he did this by himself. So can you. So you can just see, just from this, you can tell how to protect people better and what you cannot do anything about. Perhaps outdoors, maybe what can we do about the transmission outdoors, right? That's a big question now. So
Thank
residual,
you.
yes?
Uh, do you have any more? How many slides do you have?
Oh, I can take a break if you wanted. I can easily take a break.
Sure, I think let's take a break,
Sure.
10 minutes so that people
Sure.
can transfer.
Sounds
Their...
good. I will take a break, everyone, and see you in 10 minutes.
Great, thank you. I'll see you in
Thank
10
you.
minutes.
Yeah. I will have to go.
Hi Neil, are you there?
Yes, I am.
It's good. Let's continue
Perfect.
presentation.
Yes, thank you very much. I am going to pop my slides on again. There we go. Hey everyone, welcome back. I had a quick bite to eat since it's lunchtime in Bangladesh. So we will move forward with residual transmission, and we're looking at how to the residual transmission. The food has gone to my brain. Transmission that persists even though we had good coverage of interventions like bed nets and IRS. When we had that transmission is called residual transmission. The residual transmission would be this gap in protection that we see in the figure on the right, right? Even though we have an intervention in place and hopefully good coverage, there still might be protection, and all that transmission is called residual transmission. Many countries have this. In fact, all the transmission we have now when we have bednet distributions all over the world is probably due to residual transmission. Residual transmission reflects a mismatch, right? And if you can see on the figure on the right, the gap in protection, that's a mismatch between how the intervention functions with human behavior and vector behavior. So that not complete match, the mismatch results in there being continued exposure, right? People are outside, the mosquitoes are outside, interventions are inside, which means transmission, residual transmission, gaps in protection continue outside. So let's say, and here's an example, there's high bed net use, which is a really good thing. Uh, and the interpretation is that interventions are present and being used. But we have malaria, consistent and persistent malaria. And because we have malaria, we know there's a gap in protection. We know gaps exist. And then we design our entomological surveillance system to understand this, and we understand that there's outdoor biting. Does that outdoor biting result in transmission? We'd have to figure out if there's outdoor exposure. And that will tell us if there's a gap in protection based on outdoor biting and outdoor human presence. So now we've looked at a whole bunch of different kinds of data. And now how do we integrate these multiple data streams into a decision? And I already gave a couple of examples of how to do this, and we might go over one or two of them again. So how do we integrate, how do we have an integrated interpretation of our data, right? If our question is, why is transmission persisting? And our data stream tells us bed nets are being used and it's high usage, cases are up, a large number of cases, arabiensis is present, there's outdoor biting, and humans are outdoors. Right, all of a sudden you can see we're integrating multiple data streams of bednet usage, number of cases, epidemiology, your mosquito species and vectors, as well as your humans, what they are doing. So an integration of all this tells us that transmission is persisting because of outdoor transmission. And this is exactly what Ali Omar found in Pemba Island off the coast. It's just close, it's part of Zanzibar. Two islands make up Zanzibar, and Pemba is the northern island. So that's what Ali Omar found out, that all the transmission outdoors is in yellow. All the exposure is happening in the yellow space, which is outdoors. That's a good example, I thought. Yeah. Another thing that we have to be really careful is not to use a single indicator to make a decision. Ignoring human behavior is not a good thing. And here's a confusing thing. We should not confuse correlation with causation, right? And here's an example. When it's hot and dry and summer in Chicago, ice cream sales go up, right? That's causation. It's hot, so everyone wants to eat to cool down and they eat ice cream. So hot temperatures result in higher ice cream sales. However, when it's really hot and everyone's out in the sun, they also get sunburned. Well, probably not me, probably not a lot of you, but let's say a bunch of people in Geneva in WHO who are making decisions about malaria control, they get sunburned in this hot weather because they're out in the sun. And that's causation, right? But do sunburns result in higher ice cream sales? The answer is no. Do higher ice cream sales result in sunburn? The answer is no. So there's a relationship, there's a correlationship between high ice cream sales and sunburns, but they're not caused by each other, right? I hope that makes sense. So just because you have high mosquito numbers, ice cream, doesn't mean you have high mosquito cases, sunburn, right? You need to have a causation, and that causation pathway is part of the whole process that we went through. What species? Where are humans? Where are mosquitoes? Are they indoors? Are they outdoors? And understanding that will give us this causation pathway and allow us to relate one outcome to the other. Correlation is not a good thing. Also, we want to not collect data without defining decisions, right? And we don't want to overcomplicate the analysis. We want to stay simple. Let's just focus on what we want to answer and get to that. So the key takeaways, and Wulan, I forgot, I just had five slides left. I should have done them and then taken a break. The key takeaways are data is not information, right? Information supports decisions, not data. Information should support decisions. Mosquito density doesn't explain much at all, right? We need to have, causation versus correlation. We want to make sure we understand that. Human behavior is super important. Malaria is caused by the interaction between humans and mosquitoes, right? And that's the next point. Multiple data sets should be interpreted together, and surveillance is only successful when it changes decisions. I think that was my last slide for this set. Wulan, I'm sorry. I should have remembered. I was almost at the end, but I
No
will quickly
problem.
I will quickly pop up my last slide set,
Sure.
which is,
No worries.
yeah, thank you. Oh, I forgot to share and I opened it up. Um, I just ate a quick snack on the break, and my brain is focused on the snack right now. Okay, my last slide set, actually second to last, and I'll tell you why. Uh, so from entomological data systems to action, how do we move all the data we collect to, which is based on making a decision and actually do something that changes malaria? Better data makes smarter decisions. So that's my next slide set. And just as a note, yesterday a couple of you all had questions on spatial emanators. So I got a quick slide set together on spatial emanators, and I'll do that quickly. It won't take long, maybe 5 or 6 minutes after this slide set. So thank you for being patient, and I hope it's useful for you. So far, we went from asking a question based on a decision, to data, to surveillance, to data management, to interpretation. So now what do we do with this, right? We've gone through this whole process. We've cleaned up all this data. We've made data dictionaries. We've analyzed it. What do we do now, right? Now, we want to improve malaria control. So that's what our objective is, which our entire data system. We are focused now and all this collecting, managing, and interpreting. Now, what is the most important part? What do we do with this data, right? It's only useful. Everything we do is only useful if it influences or impacts decision making. So again, we went through this is the complete surveillance cycle, and we are at action right now, from decision to action, right? We ask a question, we get the data, turn it into information, make a decision, action, do something about it. And once we do something about it, we want to continue monitoring to make sure what we are doing actually makes sense. And then based on what's happening, we want to adapt it. And when we adapt it, we optimize what we're doing and getting the maximum results back. And then we can continue back to the beginning with a new question, because now we've changed transmission, hopefully for the better, and we've restarted everything, right? We have done the best job we can. Now, how do we go back and do it again to reduce transmission even more? So many systems stop at reports. As you can see, this is far more than just reports, right? Successful systems continue, and they continue through decision making into action and monitoring and optimization. So again, this is just a quick figure that just shows that. A lot of times data collection ends up in a report and it ends. Data collection is not success. Improved malaria control is success. So, improved outcomes, that is success. So, how do we select interventions? I'm focused on interventions because this is what a lot of a lot of ministries of health focus on, right? How do we best protect our people with vector control interventions? And of course, epidemiological interventions. But how can our surveillance inform at least the vector control interventions? Now, let's say our surveillance finding reports that there's a lot of indo exposure. I'm going to change the word biting to exposure, right? Exposure is happening indoors. So, a possible response, and I'm saying possible because these are just really rough examples, a possible response is bed nets, because bed nets protect people when they're indoors and people are under them, or IRS. IRS protects people when the mosquitoes that go indoors and rest on walls indoors are killed by the IRS, right? Let's say the surveillance found that outdoor exposure, not biting, that's my mistake, outdoor exposure is happening. We might want supplemental tools. Can we put in larval source management or LSM or maybe topical repellents or spatial repellents outdoors, right? We might want supplemental tools because indoor interventions like bed nets and IRS don't work that well on outdoor biting. On outdoor exposure, I mean. See, I just made a mistake as well. Outdoor exposure. Let's say we identify a lot of productive larval habitats. Great. We can attack them with larval source management or larviciding. If there's high resistance, we might want to switch to alternative insecticides. And let's say humans are outdoors a lot, because let's focus on humans as well. We might give them SBCC to tell them to go indoors, or we might provide them with some kind of outdoor protection. So different transmission systems require different kinds of interventions, right? The intervention should fit the transmission system. And the key point here is modes of action. What is the mode of action of the interventions we have available? Because that mode of action has to fit to our transmission system. I hope that made sense. It has to fit to what's happening. It has to interrupt the human biting sort of paradigm, what's happening at our site. And here's an example for bed nets. And some of you all might have seen these slides before. The mode of action MOA of bed nets, ITNs, insecticide impregnated bed nets. How do bed nets work? Bed nets work on late night indoor biting mosquitoes, right? If a person is under a bed net, they're protected, and they're usually under a bed net late at night, and they're sleeping later at night, right? Humans have to be indoors and under the nets for them to be protected, correct? And mosquitoes must be susceptible to the insecticide for them to be impacted by the bed net. So now we're looking at three forms of data from the intervention, from the mosquito, and the human. And those three will tell us the mode of action of the how the bed nets function at our site. However, to me personally, more important than this is how bed nets don't work. And when we're looking at the mode of action and trying to implement intervention at our site, we often look at how it works, but I would like you to think about how it doesn't work because every single one of these points results in malaria cases, right? Bed nets do not function in early evening or outdoor biting mosquitoes. When people are not under nets outdoors early in the evening, they're not protected and they might be resistant. So if we understand, we get data from bednet usage, bednet coverage, humans indoors, humans outdoors, human usage of bednets. I just said that. Mosquito biting rates, indoors and outdoors. We can actually understand how bednets work at our site and how bednets don't work at our site. And that will tell us the amount of protection we can actually have at our site with bednets. I put in spatial emanators or spatial repellents as well And here I haven't changed SR to SE, and I'll go over why later on. Spatial emulators function within the space they are implemented, which is usage, and humans have to be within that space to be protected, right? Spatial emulators have to be implemented at the appropriate application rate. You have to have enough of them at a place. And mosquitoes are ideally, not necessarily, but ideally susceptible to the insecticide. And conversely, spatial repellents don't work uh, in places where they aren't there, where they are under applied, or mosquitoes may be resistant because we have lower repellency. So again, understanding how the specific intervention we are looking at works, what its mode of action is really important. So how does our surveillance system inform the selection of interventions? Again, we just went through this. Indoor biting, again, a mistake on my part. I'm pretty sure you know exactly what my mistake was. This should be indoor exposure and outdoor exposure, right? Based on what's happening, where the mosquitoes are biting and resistance levels and what people are doing, we can possibly look at these responses, right? We might have to evaluate them on site, but just this subset of all the interventions available give us it narrows down what would work better at our site, right? The intervention should fit the transmission system. So here is an example, three examples. Let's say we have the same amount of malaria at all these sites, three sites, district A, B, and C. And each one of them would need different solutions. For example, District A has only indo, again, my mistake, exposure. It should be indo exposure. District B has outdoor exposure. As you can imagine, your mode of action might need to change. The intervention mode of action might need to change between District A and District B. And let's say District C has either A or B, but it's highly seasonal. You have highly seasonal transmission. And over here, just because we're entomologists, we shouldn't just focus on entomological or think about just entomological interventions. Perhaps SMC or seasonal malaria prophylaxis might work really well at a site like this, right? Enhanced diagnosis and treatment. The seasonal profile will tell us also when to put in the IRS, like right before the peak start. It'll tell us when to put in bed nets, right? So things like this can really inform what intervention to put in where. We might have the same amount of malaria, but we would need completely different control strategies. And our system that we develop can actually help us answer this really well. So subnational tailoring, and this is targeting interventions. Where should we put what intervention? Excuse me. In the past, we have we have taken an intervention and given it to the entire country, to the entire area. And we know now that this doesn't work as well because of everything we went through earlier on. Mosquito species change, their behaviors change, especially humans change depending on where they are, what they're doing, the seasonality. So exposure profiles will change, which means that different interventions will work differently in different places. Right. So that is what subnational tailoring is about. It uses local level data to create targeted intervention maps. So the question we would ask is, where are people getting exposed? Who's being exposed? When are they being exposed? And what intervention might work best in that place? So in Uganda, they have the map here is of various amounts of malaria across Uganda. And I was looking for their intervention subnational tailoring map, and I cannot find it. I have it somewhere and I could not find it. What Uganda has done is basically based on the amount of malaria and what's happening at those sites, they are targeting either IRS or bednet distribution, which is what they have available. And so they're trying to make the best intervention choices based on what's happening in that location, which is really good. So a key point is targeting who is at risk as well, right? If we give everyone the interventions and perhaps only some people are more exposed, whether it's by geography or it's by sex or it's by job, like in Cambodia, for example, right? We want to target who is most exposed. So, example, if you have limited resources in the map of Tanzania over here, the red is really high transmission. If you have limited budgets, you probably want to target the area in red for interventions. However, if you're looking at more granular data, you might want to target children who have the highest burden or pregnant women who have severe outcomes. In areas like Cambodia, it's the forest workers who actually have all the malaria. In Myanmar, people are migrant workers or people in camps have the most malaria, and maybe we want to target them for malaria interventions. Migrants who have limited access might be huge reservoirs of parasites, and we might want to target them as well. So we want to target who is at risk, right? The goal here is to be precise, to take our limited resources and focus it on who is most at risk, who is exposed most, who has the most malaria. So when do we intervene? When do we put in the intervention? I'm pretty sure I can go through the slide pretty quickly because you know the answer to this. Our data system can actually tell us where and when malaria is happening and what is driving it. And in the map on the right, you can see seasonality maps of malaria from China. And you can see that they actually have P. falciparum in red and P. vivax in green. And you can see the maps of malaria out here that they're really seasonal. And you can see when they started strengthening malaria control and treatment based on seasonality, and you can see it immediately going down. And then they had the elimination program in 2010, and we all know they eliminated malaria. So utilizing what's happening in your system to your advantage can help you make better decisions. So your data collection system can identify when to put in the intervention. For example, when it rains, when larviciding would be most effective, right? When are the peak transmission seasons? And you can actually prepare the entire system, your response system, get your ACTs and treatments in order because you know when, based on these maps, based on these figures, you know when you can expect the malaria to start going up. And this is related to other diseases as well, like dengue. You can expect and wait and prepare yourself for all this. So, timing of when you put in your intervention, targeting when to put in your intervention can matter as much as coverage. So now that we've actually done something and implemented our intervention, how do we know it's actually working, right? And so once we put in our intervention, we want to monitor the system and respond to it appropriately. Implementation of your intervention is not the end. It's actually the beginning of another cycle, where we put in our intervention and we're changing transmission, right? Every time we put something in, we've changed transmission. We're killing off mosquitoes. I hope you remember from yesterday what the three things we've changed entomologically are, right? And if we've changed transmission, we need to ask new questions. What have we changed? How have we changed it? Is it good? Is it bad? Right? What do we do now that we've changed things? So when we implement an intervention, just remember we've changed three things. I hope you remembered them. From an entomological perspective, the first thing we change is species composition. So here's an example from Kenya, where you can see the proportion of species. The black is the proportion of indoor-biting species, and the green is outdoor-biting species, right? So you can see in 2003 and 2005, there were a lot of Anopheles gambiae, which is the indoor-biting species. And then they put in bed nets. And what happened? We killed off the indoor-biting species. And you can see it went down in 2007 and 2008. But since this is proportion, the outdoor biting Arabiensis remained about the same. It looks more here, but it's proportion. So our indoor intervention changed species composition. And this change moved transmission from indoors to outdoors. We completely changed the transmission system. So now we had to ask new questions and figure out how to attack this. Behaviors, we change mosquito behaviors. And this graph is from the Solomon Islands. And in this is from, oh my, I'm forgetting. No, I'm forgetting, but it's right on the figure from 1971. Here, mosquitoes were biting in the middle of the night. You can see this is 6:30 in the evening. 6:30 in the morning, and this is the number of mosquitoes per person per night. You can see in June 17th, 1971, they were biting at midnight. And then in June 1971, also a lot at midnight. And then they put an IRS with DDT, and they were spraying them, and they killed off all the indoor biting ones, and transmission moved, exposure moved outdoors. And earlier in the evenings, before people were going into houses, while people were awake. So you can see how just IRS changed the overall mosquito population there and changed transmission to where there was continued transmission. Insecticide resistance is the last one thing that changes, and I don't need an example because I'm pretty sure you all know what that is. So monitoring indicators. So every intervention requires different indicators to monitor. I've just roughly listed them out here. And the indicators you choose would depend on the mode of action of that specific intervention. So for bed nets, you'd want to look at density, biting rates indoors and outdoors, and human exposure, combine it with human biting, what humans are doing. For IRS, you'd want to look at the indoor resting density because that's the mode of action. For larval source management, you'd want to look at larval density at all the sites you treat. For spatial eliminators, you might want to look at human landing rates and exposure. What are humans doing at this when they're inside and outdoors? Please note, and I'll say this quickly, that for spatial eliminators, if any of you all ever use them, human landing rates are the best way to do this, and not with CDC light traps. With CDC light traps, something really strange happens where when a mosquito is exposed to these volatile chemicals, they kind of freak out, they don't know what to do, and they fly away or trying to get away, and they fly towards the light. And CDC light traps have light. So when we use a CDC light trap with spatial emanators, we get more mosquitoes at the site with spatial emanators than without spatial emanators, which is really interesting because it looks like we get more mosquitoes at that site, but it's not the case. The actual case is that the spatial emanators change these mosquito behaviors and end up getting higher catch rates, even though you're having a good impact on mosquito numbers and population, which you can see with human landing catches. So your indicators and the methods, obviously, like I just mentioned, should match the intervention and its mode of action, right? A good question to ask is, we implemented this intervention, what did we expect to see? And follow up on that. So adaptive management, right? We observe, we interpret, we respond, and we observe again. And that's what surveillance is about, right? We keep seeing what's happening. We analyze the data, we respond. We see what happens, we respond. We make a decision. We keep doing this. The transmission system changes, and as the transmission system changes, we need to change as well. So an example of responding to insecticide resistance, surveillance detects changes in insecticide resistance, and we can respond to it, right? Without surveillance, and this is kind of important, without doing this, resistance can go unnoticed because you don't see it, right? You can't see insecticide resistance. You have to do a test for it. This can go on for years and years and years. And this is just an example of the WHO Global Threats Map of Anopheles resistance, insecticide resistance, and you can see it reported data points, not all data points, because a lot of the data points are not reported. These are all reported data points for insecticide resistance. And here's an example. And let's say at a site in 2020, and red is resistant, there is 5% of mosquitoes are resistant. That's, you can see 5%. I totally made up this figure, by the way, so don't believe it. And in 2025, 60% of them are resistant, right? So what do you think? Should the intervention strategy remain unchanged? Should we have made the decision to change things in 2020 or only at 2025, right? This is something for you to think about because a lot of times I do not understand the threshold for decision making in ministries of health. because every country is different. Like, should we change the second we see resistance, or should we change when it gets to 40% resistant or 10% resistant? I do not know the threshold, and it's so different everywhere. So, understanding what your system allows you to do and what your thresholds for decision making and changing in policy and getting a new insecticide or changing from bed nets to IRS, it's all different. So, understanding this would be really important. And this IRS example, I think, helps. I would have technically started procuring new insecticide when it was 5% because I know it's going to increase, right? We all know it's going to increase, but it's different everywhere. So, with behavioral change, in the earlier example, you saw in the Solomon Islands how, with DDT based IRS, all the mosquitoes started biting earlier in the evening. So, how can we respond to this? So, over there, we found in Central Province in the Solomon Islands, we found that the mosquitoes changed from in the middle of the night indoors. And you can see in this graph here, this on the left is the number of mosquitoes, and at the bottom of the hour of the night. The solid line is outdoor biting and the dotted line is indoor biting. You can see most of the mosquitoes were biting outdoors earlier in the evening. And what did this mean, right? What the evidence says and what were the implications, what the data said and what was the evidence. Information, I mean, sorry. This meant that when we looked at human behavior, most of the people were outdoors earlier in the evening. So 84% of the biting was happening outdoors when people were unprotected, even though indoors they had IRS and bed nets. So malaria continued, right? And then what was the solution? So the country had to decide, now what do we do? How do we protect these people, right? So behavioral adaptation, as you can see in this example, can absolutely reduce intervention effectiveness. And we must follow up and look at this. We often don't, but we need to look at this. Here's an example of human behavior change and how we can change things, how we can use it to our advantage. So let's say there's 90% bed net usage on the left, and I used the same mosquito profiles to understand this. This is exposure to mosquitoes. So human behavior adjusted bites occurring outdoors is in red. There's low mosquitoes outdoors and low people outdoors. And the behavior adjusted bites occurring indoors when people are asleep in the light blue. The bed net like pattern is people protected under bed nets. And the blue, the darker blue, is people occurring when they were awake. So you can see just a 90% bed net usage to a 50% bed net usage can completely change your exposure profile indoors, right? And that's represented by the light blue. The problem might not be the intervention. You might be putting a really good intervention that works out there. Us humans are often the problem. And our surveillance system can identify exactly what is the cause of the gap in protection, what is causing the exposure. So the next point is to develop a sustainable surveillance system. A good system is one that's still there 5 years down the line or 10 years down the line. Simple systems are better than complex systems, and many systems fail because they get too ambitious. We want to do everything at once. I would stick to the minimal essential things to answer the minimal essential questions within our budget envelope. How much funds do we have? Use them not to do everything, but use them to get the best information to make the most important decisions. Simple systems work best. And an easy way of looking at this is to keep your indicators you collect, limit them to the minimal essential. Once you standardize your methods across all your sites, you're using the same things again and again, year in and year out, and it doesn't change. So all your data is standardized, your methodology is standardized. When communities are involved, you build ownership. When people at the district level, for example, are involved in collecting and designing this, you also build ownership, and that helps with sustainability. Integrate what you are doing with existing systems and focus on decision making. I would look at sustainability as part of design, of data system design. So when you're designing your system, remember you're in charge, right? When you're designing the system, think about sustainability. What's going to happen in 5, 10 years? A data graveyard. uh, I think y'all know what data graveyards are. This is all reports and data that has never been used. I have computers, hard drives full of dead data that will never be used, which is so unfortunate, right? So many programs, and I'm sure all of you have data you have never used. So who actually, a good question will be when you're collecting data is who will actually use this information, right? So a good Ento system, of course, is directed at actionable insights. So if you look at this huge pyramid, we collect too much data, we get less information. At the end, we just do a few things. And the key point is these few things that we can actually do, the actionable things, data that we can turn into action. So a good way of actually interpreting this is to start off by collecting actionable data. What data do we actually need to answer our questions? A simple example of this is my university has a travel system. And whenever I have to travel, like I am right now, I have to fill out all these forms of data. It takes me about an hour to fill out all this data. And I call them and I was like, who's using this data? What is it for? Why are you wasting my time, right? What data do you actually need to make a decision, to act on? Why do you need all this data? And thankfully, like a group of us got together and was like, you're wasting our time. And they actually changed it to be focused. And now it takes me about 10 minutes, 15 minutes, depending on where I'm going, to enter all this versus like hours of time. So it's the same thing applies to exactly what we are doing, right? In terms of entomology, focus in on exactly what we want to achieve. What are our actionable insights? Almost at the end. 10 rules of useful entomology data systems. So start with the decisions. What decisions do you want to make? Uh, Collect only what changes the decisions, as I just mentioned. Just focus in on what you want. Be simple, right? Your data quality is hugely essential. It's very important. We don't have to collect PhD level data for our ministries of health. We do not. It would be great, but we don't have the money, time, or resources. Collect representative data. Try and link your entomology to epidemiology, and it's essential. The epidemiology and then everything else around it, all your metadata as well. To me, understanding human behavior at my site is essential, not just to understand where and when transmission is happening, but also what intervention would work best in that space. And as an example, when we were in Cambodia, we were doing a study with topical repellents, those topical repellent creams, and the community refused to use one because they didn't like how it smelled, right? So talking to the community, human behavior, understanding what they like and what they don't like is really important. And in fact, that intervention would completely fail if we distributed the wrong topical repellent. Sustainability is hugely important. How you interpret data is really important. Remember causation versus, right? Remember that slide? Ice cream and what? And summer, ice cream summer and sunburns. Yes. I was just reminded by a participant over here sitting in front of me. And surveillance must need to lead to action. Everything should be focused on decisions. So I have a couple of slides on communicating data. Now that we have all this data, we have all this information, we really know what we want to do. The next step is to actually communicate this data to people. And this is perhaps one of the most important things, because how do we convey all the hard work we've done, all this managing, interpreting, analyzing all this data, collecting all this data, and then we have to communicate it to people who actually make decisions. Now, all these pictures over here actually mean the same thing, right? And how we present it is based on who we present it to. And I'm telling you they mean the same thing, even though I don't explain this. It's actually human behavior and mosquito behavior and exposure data, but they all mean the same thing. And they can each be directed at different target audiences. So when you're presenting your data, when you're sharing your data, right, how to do it effectively. The first thing is to know who you're targeting it to. For example, a lot of, let's say you're looking at a minister of health. Now, there are many different kinds of ministers of health. Some of them are doctors who don't care about entomology. Some of them are politicians who absolutely don't care about anything. I'm kidding, but you know what I mean. Some of them might be entomologists, which would be fantastic. So imagine presenting to a politician human biting rates. Indo and outdoor Anopheles gambiae human biting rates. They don't care, right? We love it. We've spent all our time on it. We want to target our data to them. What we should be telling them is we need this to protect people, and that's it, right? To that politician. Your image would look really good if you protected this community because that's what they focus on. I'm trying to make a joke, but I think you know what I mean. So understanding your audio or your audience expertise, what do they know? How would they understand your data? Right? What do they need to know? What is the objective of my presentation? Am I trying to just report to them? Am I just informing them? Am I trying to tell them we need this intervention for this reason? Right? Are we trying to get funds? So all of these different objectives would require a different presentation strategy, even though your data and all your everything you did is exactly the same, but how you present it would be different. For example, most people do not want to listen to scientific SOPs and analysis methods. Most people do not. A lot of the times I do not either. So when you're presenting your data, try to make sure it's relevant, accurate, and contextual. So when it's relevant, it means what supports the objective of your slide, right? We have all of your presentation, not your slide. We have all these data endpoints on the right listed out, but which ones actually support the objective? If it doesn't support, leave it out. Your data has to be accurate. And here's an example of it. So let's say we have 12 months in the year, and in reality, the mosquito biting rate is 5 mosquitoes per person per night in month one, 10 in month two, and this is what's actually happening. But the actual data we collect, I only collected it in month three and month nine. So I only have data from month three and month nine. Now, that's the actual graph, what actually happens, right? If I were to present my data accurately, I'd present it as a bar graph, right? Because that's when we collected the data. But if I joined the lines and made sort of a curve that is in green, it would look like that. The orange is wrong, right? It doesn't represent reality because the actual data is in green. So what we should present accurately is this bar graph, right? Representing months three and nine. If we joined those lines, that would be wrong. So you can see how easily it is to misinterpret that data, present exactly what we did, right? Context. So I'm taking that same slide and saying, I'm going to present this. And if this was up on a slide, what does this mean? Do any of you know what this means? I'm pretty sure no. So what is the x-axis? What is the y-axis, right? What does this mean? So an easy way of doing it is just pretty simply to mark exactly what we want to say. The month of the year, the total malaria cases diagnosed, and malaria cases, a title, malaria cases January to December. And I wanted to say that the malaria peaks happen in July. There, done. Put it on the slide so people don't have to try and figure out what you're presenting. Try and be simple, right? Minimize clutter, use less colors, focus on the key things you want to say. For example, if I wanted to say the malaria parasite is transmitted between humans and mosquitoes, I could use the figure on the right. And if I use that figure, everyone in your audience is going to be trying to figure out exactly what it says, even though it says exactly that. Or you could make a really simple figure. Now I made up this figure in literally 2 minutes, so it's very simple. You could say that Anopheles vectors, human hosts, parasites transmitted between them. That's super simple, right? You could do that as well. So try and be simple with what you're presenting because too much information will overload a brain. Use consistent scales. This is important. Now, if you looked at these two graphs up and down, they look exactly the same. And if you're presenting it, people will think, oh, the monthly Anopheles capture rate in site A and B are the same. However, you have to really pay attention. Can you find a difference, anyone? I'm sure you can. Yeah, the scales, use consistent scales. One of them is 60 and one of them is 600. So if you actually were to present it accurately, that's what it would look like, right? So use consistent scales so people can actually see what's happening with the data. Try and be clear and limit the less you put on the slide, the better, right? Less text, the better. So, for example, suppose I put this up on a slide. How many of you all started reading it and stopped listening to me, started trying to focus, try to finish reading it before I switched? I'm going to switch slides. I'm going to switch slides now. You're going to lose track of what's happening. So, an easy thing to do is not do that. The less text, the better. What you can do is what I did on the next slide, which is try and tell a story. Try and have everything flow from one thing to the other with your data, even though it's a data, tell a story. And all the text on this slide is actually here. I was trying to say, I want to understand what interventions we need to implement in a site with low bed nets. So I looked at mosquito, human behavior, and bed net presence and usage. I could understand when people are protected and when they're being bitten. And based on that, I could understand indoors we would need these interventions and outdoors those interventions. So make it flow, make it simpler. By the way, it's exactly what I said over there, and it's completely presented differently. So know your audience, data should be relevant, simplify, 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 design for readability, and tell a story. And if you can present your data that way, you'd make better decisions. People will listen to you and make better decisions. So if you remember on day one, I asked you to pretend that you had been appointed, or maybe you are, appointed the technical lead for malaria surveillance and control in your country. And by now, I hope you know what data would matter for your national strategic plan, right? You could go through based on what data you need, what decisions you need to make towards understanding what what ento data matters, how to collect it, structure it, interpret it, and use it for making decisions. So that's the final summary, the simplest summary I could think of. You have your question or your decision, you collect your indicators that produce your data, you convert that data into information, and you act on it. And part of action is monitoring, evaluation, responding as well. And this simple slide, if I were to make it slightly more detailed, so I actually put this entire slide set I made into Chat GPT and asked it to make one figure. And thank you, Chat GPT, for making this figure, because I did not make this. Designing entomological data systems for malaria control. So we go from understanding data needs to designing the system, collecting quality data, manage and analyzing data, interpreting and communicating, applying this decisions, monitoring, evaluating, and adapting, and continuing, right? Now we understand the other new data needs because we have new questions, right? And the malaria data can inform malaria control decisions as outlined on the right. I'm not going to go through this slide, but you will have it with you. Thank you, ChatGPT. You will have it with you at the end because you're going to have access to all the slides. So my second last slide in this whole thing is the success of entomological surveillance systems is not measured by the number of mosquitoes you collect, or the number of sites you sampled, or the size of your database. It's measured by whether it improves malaria control decisions. And my last slide, some of y'all might have seen this before. So Jose Najera, who's a former WHO epidemiologist, he said that before DDT, DDT was used in IRS, malariologists were trained to be problem solvers, right? But after DDT, malariologists were trained to be solution implementers, as in we were given DDT, go spray it everywhere, and stop thinking. We were given bed nets, go give everyone a bed net. You don't have to think, just give everyone a bed net. And we need to move back to being problem solvers. And this entire course helps us sort of understand how to understand the problem and how to solve it, how to best try and solve it. And that was my last slide. And thank you for that. Oh, I forgot. The quick spatial emanator one. I have a couple of minutes spatial emanator study, which some of you all asked for. I forgot about that. Well, I didn't forget about it. I forgot about it 30 seconds ago. Uh, Let me share my slide set. Uh, there we go. Okay, spatial emanators. By the way, this is my favorite slide I ever made in my entire life. Spatial emanators are a new vector control tool that has conditional recommendation by WHO. So here's the problem, and I think you recognize this, right? So even though we have a lot of bednets and IRS about, malaria is still around. Bednets and IRS only work in certain cases, and you know why. We just went over that. And most exposure happens outside those conditions where bednets and IRS work. They happen in the gaps in protection. So in August of 2025, WHO recommended the use of spatial emanators or repellents as a new complementary tool for malaria vector control. So they recommend it uh, with proven methods like bed nets or IRS and indoors, not by itself yet, but they recommend it with. It's really cool because it's the first WHO recommended vector control class in over 40 years, right? There are two products available right now. Well, technically only one, but there are two products that are PQ approved, Mosquito Shield and Guardian, both produced by SC Johnson. Mosquito Shield is not available anymore, but Guardian is. It actually lasts one whole year. So you hang it up and it lasts a whole year. So what are spatial laminators or repellents? Uh, Spatial laminator products, they release a volatile chemical. So you can imagine right in the middle, we have this SR, which is your spatial repellent, a spatial laminator product, and releases a volatile chemical that's more concentrated, close to it, obviously, and the concentration goes down, airborne particles. And that creates a cloud of these airborne particles that reduce human mosquito contact. The mosquitoes don't want to go in there, and I'll tell you why in a second, right? So spatial repellency refers to a range of behaviors that these airborne chemicals cause. The mode of action, if you remember MOAs, the mode of action is multiple. So they actually can, so there's personal protection. That means if I use it, I'm protected. So what happens is the mosquito comes towards me, I'm using a spatial repellent or a spatial emanator, and it flies away because it doesn't like it. There's community protection, which means if I'm using it, you who might not be using it is also slightly protected. And that is because a mosquito that is exposed to these volatile chemicals, they are disarmed, which means they don't feed, or they knock down, or they rest without feeding. And just imagine this, you go out to eat some really good food at a restaurant, and there's this really, really awful smell around. Do you think you're going to feel like eating? Probably not. And that's kind of what happens. Imagine it's a toxic chemical, like an insecticide with mosquitoes. So these mosquitoes don't necessarily die or aren't necessarily just repelled, but they also are knocked down, and some of them die, some of them stop feeding, and all of these increase their death rate. And when you have less mosquitoes biting people, you protect the people who don't have personal protection, who aren't using the product. And because there are so many impacts of these spatial repellents, WHO is now calling them spatial emanators. So spatial emanators cover repellency, inhibition of biting, increased mortality, and inhibition of landing, right? So multiple impacts. That's why we call them spatial emanators now. So where do they actually add value? They protect people when people are not under nets, right? So indoors, for example, when you're awake and you can't use a bed net, they can protect people where bed nets cannot be used or IRS cannot be used. Uh, they target in outdoor and peri-domestic use. So there is data. So the caveat is WHO only recommends spatial emanators indoors with bed nets or IRS. but there is entomological evidence for their impact outdoors and in peri-domestic areas. Um, with WHO's recommendation, they want it as a complement, as I just mentioned, to IRS and bed nets, and they do not suggest replacing them because there's no data yet that spatial repellents alone can reduce disease significantly. There are trials that are upcoming, and we will let you know as soon as they're done. The cool thing about these commercially available spatial laminators is that they're passive. You just hang them up and you forget them, and they last a year, right? A lot of issues with any product is compliance, and it's user dependent. Like you have to put up your bed net, you have to put in your topical repellent, right? You have to do all these things every day to get protected. Kids don't do it. Sometimes I don't do it. Like I can't expect communities to do it. So a passive product that you can just hang up and forget is really nice. So in the figure on the right, you can see the gap in protection with vector behaviors and human behaviors overlapping. And with the WHO recommendation, let's say you have bed nets out there, and the aim or the objective or the theory is that's where we put spatial laminators, right? So spatial laminators can increase the protections afforded by just bed nets. Where can we use them? What are the operational advantages? Is that we can use them in high transmission settings, in areas, IDP camps, and in emergency context because they're light and we can transport them there easily, in mobile populations where bed nets cannot be used, as well as outdoors. For example, in this picture was from, I'm forgetting, uh, Cambodia. I think it was from, no, Indonesia. In this site, we used spatial emanators in this open structure, and it was very protective. There are multiple distribution models as well. You can distribute them through health facilities, door to door. You can package them with your bed nets as well and take away all the distribution costs. They're also small and less bulky, so they're easier to distribute. So those are operational advantages. This is a picture of the Guardian spatial repellent product. Uh, and what does the data actually show? What does the evidence actually show? There's about 30 to 60% protection depending on your setting. And these studies were done in Kenya and Indonesia. There's added benefit with bed nets, and that is why WHO has this conditional recommendation. Evidence is strongest indoors with bed nets so far. And we have entomological and epidemiological evidence for that. There's limited outdoor evidence, and that's mainly entomological. In some sites, we got up to 94% reduction of landing outdoors. So that's actually really cool and represents great promise. But we don't have that epidemiological data set to support it yet. Of course, different sites will have different impacts, different mosquito species interact differently with them. So we have to understand all that as well. There are evidence gaps, and we need to do implementation studies to understand how to actually get these to people in real world settings. And those studies are being designed right now. We need to know when they can be used alone without bed nets and in outdoor settings as well. And here's an example of an outdoor cooking shelter in Zambia where we have the spatial laminated products. You can see this sheet hanging up there. And this is the product we're going to be using in Bangladesh right now in an upcoming study that's going to start. And this was actually really protective in this open area, which is really cool to see. So in short, SCs or spatial laminators are a promising complementary tool, complementary by WHO definitions, especially for protecting people outside sleeping hours. It can be considered a part of an integrated vector management strategy and for vector control decision frameworks. And we need to generate more evidence to fill up these gaps. And that was the end of my presentations. I hope that was useful. Wulan, let me have a
Excellent.
sip of water while you tell me what to do.
Yeah, sure. So yeah, excellent, Neil. Thanks so much for your presentation. It's really great. Like it covers a whole topics for this data management, including the special event networks. So we're going before we go to the Q&A session, we will have 15-minute post test
Yeah.
so that Neil, you can have more time to have a rest. So I'll share the link in the chat box. So we will have 15-minute post test for everyone. So please make sure that you use the same email address with the one that you used during the pre-test. Here I share the link in the chat box. So turn off. I'll turn off the chat box so everyone can see the link I shared. And then please start from now as I'm running my timer for 15 minutes. Thank you. Thank you for those who completed the post test, and we still have 9 minutes left for you to complete the quiz. Thank you. Please stay in this training because we're going to have the Q&A session right after this post-test questionnaire. we will have Q&A session after the post-test. So we have 2 minutes left for the quiz. So after this, we'll continue with the Q&A and then a short poll. And finally, later on, Prof. Leo Bragg will close the training after the short poll. All right, I think we can continue with the Q&A session as we've been receiving almost 500 responses for the post-test. Just checking, Neil, are you there?
Yes, I am here. There I am.
Hi, Neil. Welcome back.
Thank you.
So I'm just not sharing my screen here. Yeah. So I will let the post-test link open so that participant can use the link and then fill out the quiz. Thank you so much for your presentation. Let's start the Q&A session with this one. This question's from interesting question from the audience on do we really need to count the actual number of mosquitoes or can it be counted by an easier way in terms of because we're talking about the data here. So do you have any response?
Yes, we need the numbers of mosquitoes, and that's pretty intensive, especially sometimes you catch hundreds and hundreds of mosquitoes a night, and you have to go through and sort through them and identify them. Yes, that's unfortunately a very integral part to what we do, and which makes us entomologists slightly crazy, which is a good thing.
Yeah, I
Yeah.
agree with you. There's no such shortcut to
Yeah. But they are developing traps and different kinds of traps that can actually identify mosquitoes as it catches them and count them. They're kind of expensive. And there are also species identification tools, like, for example, there are apps that you can use on your phone. Oh, there's my phone. Apps you can use in your phone, which you, with your phone camera, you can take a picture of the mosquito and it will identify it to species. And that's called VectorCam, VectorCam, and you can actually download that app and give it to to the community and ask them to help identify mosquitoes. So you can do mosquito collections and automatically just go, take a picture, take a picture, take a picture, take a picture, and identify and count all your samples. Yeah, there are things coming up that makes them easier.
great. That's really great to know that AI helps our life. Then let's just continue with this AI related questions from Nathan Kama. So use of AI, artificial intelligence, or machine learning for predicting mosquito population. Do you have any comments on this matter? Because like how can we really rely on this AI mosquito population predictions on the actual like in the program for malaria surveillance and control?
Yeah, so theoretically, it would make sense to make systems easier and use things like modeling and AI, which both function very differently, but they need to be validated, right? You need to know that the AI you're using actually works within the system, within the structure, and is applicable to your database and what you're doing. As a simple example, the vector cam that I was talking about that can identify things to species, it was tested in Uganda using AI, and the AI detects Anopheles gambiae and Funestus really well. But when we tried it in Mozambique, it didn't work as well because Mozambican mosquitoes look maybe that we can't tell the difference, slightly different than Ugandan mosquitoes. And so we'd probably want to validate how the AI on whatever you're doing, whether it's mosquito densities or intervention impact or anything, you'd want to validate it to make sure it works. Because, junk in, junk out. So you want to make sure you put in good data and what you're getting out is actually making sense. Before doing anything about it, before making a decision, I would make sure it makes sense. If anyone is going to the AMV conference in Thailand in August, there's sessions on AI at it.
Thank you, Neil, for sharing that information. Yeah, so that's also a question on, well, as yeah, I think it's more like comments and then followed by questions about human behavior observation, whether it is difficult to interpret the data because sometimes people, well, do you have any comments on that, on how do you usually do this human behavior observation and how to interpret the data if you got the information from the community?
Sorry, could you repeat? Sorry, I missed that.
This questions from Ramla Haji about human behavior observation in relation to the um, vector data management and then how to interpret the data in terms of
Ah,
behavior
sorry.
observation.
Perfect. Thank you for that question. So I actually do a whole training session on that. And what I will do is I will prepare the analysis is actually complicated when you look at it on paper, but I've prepared an analysis sheet in Excel where you just input your mosquito numbers and you input your human numbers and it tells you everything automatically. So what I will do is I'll package that, Wulan, and I will give it to you and you can post it with all the other presentations. In short, what we look at is the mosquito biting rate indoors and the mosquito biting rate outdoors as one data set. The other data set is your human behavior data set. And we look at the numbers of people by hour of the night, indoors and outdoors, if they are awake or if they're asleep, and if they're using bed nets and if they're not using bed nets, because that will tell us if they can be protected or not. And we combine both those data sets in a simple analysis. We multiply the proportion of people in each behavior group by the number of landing mosquitoes, human landing rate, for that hour. So we match both of them together. And I can share that with you, Wulan. I'll send that to you tonight, and you can put it up with everything else.
Great, thanks so much, Neil. Yeah, that's just some questions on spatial emanators. So I'll just summarize the question on uh, the approximate covering range for the spatial emanators and whether it can be used for Aedes aegypti controls or not.
Haha, great question. So I'm in Bangladesh right now. We are starting up a study with ICDDRB on using spatial emanators against Aedes aegypti for dengue control. So there's been one large-scale study that demonstrated impact against dengue. This was conducted in Peru with Shield, the SC Johnson product, and it reduced dengue by 34%. So it is effective, and the cutoff was 30%. So reduced dengue incidence by quite a lot. So yes, it is effective against Aedes.
Yeah, sorry, I was just looking for
A
my
question, yeah.
cursor and because I'm using two laptops for the moment, so it's just
Okay,
kind of
sure.
confusing. So yeah, in relation with special emanators, because there are a lot of questions on that as well. Um, can it be used by pregnant women? And then is there any observation on using special emanators and also the resistance because of that.
Of mosquitoes, yes. So pregnant women and resistance, two separate questions. So in all the studies that we have done, we looked at AEs or adverse effects or SAEs, serious adverse effects against the populations. And thousands of people have been in these studies, including pregnant women. It's important to note that the concentration of the spatial emanator product is really, really low. It's much lower than in IRS. It's much lower than in on bed nets. So the volatile product is really low. And there's been no AEs or SAs related to pregnant women in their pregnancy. So these are considered absolutely safe for humans. And they're pyrethroids as well, right? Which impact mosquitoes and not insects and not humans. We do perhaps get contact dermatitis when we, like a rash, if you directly hold the product or rub it on you. Please don't eat it because that won't be good. But yeah, you can have impacts if you eat the product, but don't. Uh, with regards to resistance, there is data that demonstrates that insecticide resistance can have an impact on spatial repellency, spatial all the impacts of spatial repellent products. Uh, but it's not necessarily shown to be enough to reduce epidemiology yet. For example, in the Kenya study, there were resistant mosquitoes everywhere. A large proportion of them were resistant, and they still had a giant impact against malaria. Right. And the reason is because the volatile product is also so low a concentration, it doesn't kill off everything. Some of them that get a higher dose will die, but most of them don't. They want to run away. Like if you start smelling something really bad, you don't go running towards it and jump into it. You run away, right? So you don't have to be exposed to it more, just like mosquitoes. Yeah.
Yeah, thanks so much for the response. And then that's also a question from Gideon Johannes. Well, actually, he posted several questions, so I'll just take one here. So most entomological data collected are numerical and interpreted descriptively, and that might be sufficient for operational purpose and tech and decision making. However, for publication purpose, how do you go about the analysis? Whether descriptive can be sufficient for publication, and
Mhm.
then should it really include molecular analysis? Because these days, like molecular analysis is just very famous for publication
Yeah.
as well. So yeah, yeah,
So it depends on the objective of your manuscript, right? If your objective is a qualitative description, that's what you should stick with. But if your objective is to actually analyze, interpret, and produce information that's useful, you might want to do further analysis. Also, if you don't have the budget to do molecular, you can't do molecular, right? If you don't have the capacity. So you'll have to focus your manuscript on your publication, your journal article on what your primary goal is. Like, what is your action, right? What is your decision? It's a similar process. What data do you need to fulfill that with the resources you have? That's funny. Writing a publication is just like the decision, and all the
yeah,
processes that result in that decision are the same processes. So that I never thought about it that way. Yeah.
yeah, that's true. Yeah, that's the questions from my university teacher. And so that specific district already got malaria elimination status years ago. And in this district, in this city, there were imported relapsed malaria cases. Is there any recommended parameters to assess in limited funding setting to assess the transmission risk in that area? Because there's only a small number of cases. And then is there any recommendation to make the data good enough for, again, publication?
Yeah. So the question is, there are very few cases and they're imported. Is
Yeah,
that?
only 8 cases. Yeah, imported cases there.
Yeah. Uh, so you're trying to look at the risk of what's happening. So what I would do is you're trying to understand if those eight imported cases can impact malaria transmission in that area when there's no malaria around. So I would probably do try and understand the mosquito exposure to mosquito rate in those areas to say, so all these mosquitoes are not infected, and this is the biting pressure that's happening in that community. Now we had introductions of eight cases. right? What is the potential? How can these 8 cases possibly transmit malaria to mosquitoes and then to other humans? So I'd probably look at it from that area. And as a publication, that might be a really good story, right? Make a story. In an area preventing malaria reestablishment in an area where malaria is already eliminated. The importation of 8 cases, blah, 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 blah. So you can write a story about that. That would be interesting because that happens in a lot of areas. Yeah, thank you for that.
Yeah. So Neil, that's a question on, oh, wait a second. I lost it. Okay, so in terms of human behavior, what kind of information we need to collect? Is it outdoor sleeping or indoor sleeping with and without using bed net? Or is there any
You
other?
Yeah, the person asking a question completely answered the question. The minimum number would be indoor and outdoor presence, and if they're indoor, if they're awake or asleep, using a bed net or not. If they're outdoors, the same questions. So you can understand when they're awake, when you can't use a bed net, and when they're asleep, when you can't use a bed net, if they're using a bed net. So yes, and I will send you those data collection forms and everything, Wulan, so you can share it with everyone.
Uh, is that the one that we used
In
for
the
the
previous
previous?
ones, yes. So you have it. You can
Yeah,
just
I think
use
I
that
can
whole
just
folder.
yeah,
Yeah, thank you.
sure. I
Yeah,
just can call the link and then put it on
thank you.
this data management training page.
Thank you. Yeah.
All right. So yeah, I would like to also invite Professor Leo Bragg to respond to these questions regarding the supplemental tool that can be helpful to
Mhm.
control the outdoor biting vectors. Professor Leo Bragg, are you there?
Yes, I am. Wulan, sorry, just repeat the question. Sorry, you're putting me on the spot
Sorry, just
here.
like all of a sudden. Yeah, so what are supplemental tool that can be helpful to control outdoor biting vectors? I think this one is just, I think, specific for malaria.
Yeah.
Yeah. So Neil needs to support me here or add on or correct me. But at least in my experience, outdoor biting is a challenge worldwide throughout the malaria endemic world that, our current preferred vector control tools are entirely indoor based, that specifically uh, insecticide-treated nets and indoor residual spraying. Those are the two uh, tools that are endorsed and supported and encouraged by World Health Organization. World Health Organization also endorses as complementary, supplementary approaches. Most recently, 25 August last year, the use of spatial emanators, but with a lot of conditions attached to it, such as only for indoor use and in association with either IRS or ITNs. And then also larval source management is endorsed as a supplementary tool. So everyone is concerned about the issue of outdoor biting because much of the residual malaria is actually the result of outdoor biting. And there are a number of tools available, uh, you know, uh, and ectocides, because many of the outdoor biting mosquitoes also are prefer biting or strongly bite cattle, etc. So, and ecticides where you treat the cattle and the mosquitoes that feed on those treated cattle will also die then. And there are a number of other tools, but none of them have proven effective to the extent that they receive WHO endorsement. WHO will only endorse a product if it does have an impact on reducing malaria burden at village or population scale. So this leads to my next point. I'm sorry, I find it difficult to talk briefly. I'll try my best. Topical repellents would work. They work very well if you use the right product. but they are effective for individual use. There's nobody that's proven that topical repellents have a population level effect in reducing malaria burden. So, you know, if you as an individual you're concerned about outdoor biting, use a topical repellent. They work, but it doesn't help you use it tonight and then you use it next week. You've got to use it consistently, regularly, and reapply because they don't last the whole night. They typically last 4 to 8 hours or so on. Neil, do you want to add anything on there?
No, I think you covered it. Insecticides, possibly spatial eliminators, possibly larval source management, which impacts all mosquitoes, not just indoor and outdoor, only indoor ones, only outdoor ones.
Attractive
All,
targeted sugar base is another
yes,
promising tool, but
yeah,
it hasn't quite proven itself yet.
correct. Yes, yeah. Yeah, the outdoor biting again is different from outdoor exposure. So we
Yeah.
might have a lot of outdoor biting, but we have to figure out where the exposure is happening. Where are people when the mosquitoes are biting? So that might help us direct our intervention selection. But you are right that where there is more outdoor exposure, we really don't have like super good interventions for those spaces and times.
Thanks, Wulan.
Thank you, that's Leo. And yeah, I think because we are running out of time, so I will ask one last questions to Neil on how can a person get that spatial emulator, and then are they provided by a specific institution or readily in the market?
Okay, great question because they're proving impossible to get now. It's driving me crazy. So the depending on where you're getting your funds from, right? So if you're using global fund funds, you have to go through the global fund mechanisms, and they should be available through the global fund platform, and that is the SC Johnson Guardian product. If you have your own funds, you can try contacting, best of luck, you can try contacting SC Johnson directly and asking them if you can use their product for proof of principle studies, or you want to see in your country, you want to make a policy recommendation and you needed to do an evaluation to find out if their product would work in your country settings. That's a possibility. Because there is such a high demand for this intervention paradigm right now for spatial eliminators. SC Johnson is basically directing, as far as I know, directing where they give it to because they're limited numbers and quantities. So they want to make sure it's really hard to get now. But if you think about spatial eliminators, they're available in the market, right? Different kinds, like plugins, and there are different kinds available in the market, especially in Asia. But the problem is we don't know if those have an epidemiological impact, right? But if you do find them useful without getting the Guardian product, I'd use them personally. I carry them around with me because I know they work and I use them. So depending on what use case, I would look at different sources. Global Fund, use the Global Fund resources to get Guardian. Large scale implementation studies, you might have to contact either Global Fund or SC Johnson correctly. For proof of principle studies, contact SC Johnson directly if you want a WHO recommended products, because there are other products also available out there that are not WHO recommended yet, and you can contact those companies as well. And for personal, you can do anything you want.
Excellent. Thank you so much, Neil, for a comprehensive response and answer for the audience. And then now I'll hand it over to Dr. Leo for the closing, the formal closing. And then please also uh, complete the poll that it's appearing here on your screen. So I'll hand it over to Dr. Leo. Thanks so much.
Thank you, Wulan. So, just a reminder, right at the start of the course, Neil pulled up a slide that showed the results of a modeling study back in 2015, where it was clear, and these findings were repeated by a IVCC report towards the end of last year, which showed that malaria control in at least in medium burden to high burden malaria countries, the 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 vector control is the overwhelming tool most effective for malaria reduction. Well over 60% of cases averted, are due to the use of insecticide-treated nets by themselves. And then, the use of artemisinin combination therapy, drug treatment for parasites and so on, is a fraction of percentage contributing to malaria cases averted. In medium and high burden countries, vector control is also critically important in low transmission countries, but it's most evident in high and medium transmission countries. So, but the point I'm trying to make is vector control is not just a case of getting in a helicopter or a plane or a truck and going to distribute bed nets, and then you can sit back and relax for another 3 years. Effective vector control is absolutely dependent on effective vector surveillance. You cannot implement effective vector control if you don't have the key data that you get from vector surveillance to underpin your vector control interventions. And Neil has just effectively, over 2 days, explained to us the complexities and importance of multiple questions you need to ask and how you go about answering those questions. So it reflects the great experience and expertise of Neil, gleaned from his many studies around the globe, that he is so competent and effective in sharing all those insights and condensing all that knowledge into little nuggets, pearls of wisdom that he has shared with us. So, for those very valuable insights, Neil, from all of us, sincerely, a great thank you to you for your time. And we hope that next year or at another opportunity, you will again share your incredible knowledge with our global audience of Vector community members. I'd also like to thank Wulan and Dr. Porn for your backroom support, and Wulan as moderator today. Sincere thank you. And then to our audience, what a wonderful group of people. My goodness, you showed great tenacity in hanging in there over 2 days. Many hundreds of you listening in from all over the planet, posing wonderful questions that showed you were engaged and you were asking very relevant questions. Thank you so much for joining our event. Hope you enjoyed it. And we will see you next time for another APMEN event. Thank you to all of you. Thank you, Neil. Thank you all.
Thank you all. Have a good day.
Thank you.